So is it genetic?
Well, so it isn't something that can be directly passed along from mother to child, but it does carry a family inheritance type of issue there, meaning you'll see it in families more often than someone who doesn't have it. So that is, in a sense, reassuring in that you don't have to expect it or anticipate it. Now you could always explain it away if new family members are being diagnosed or finding out they have it. But as far as being able to be told by a specialist, a doctor, anybody you're talking to, healthcare provider wise, an exact number, that isn't going to exist because it's just more of a association.
Many women are curious about this because they don't know whenever they're pregnant, they're going through pregnancy. Now it's almost D-Day. And it's like, okay, now it's time for this baby to come out. How does labor and delivery affect an MS patient?
So it looks a little bit different in that most patients, or I'm not going to say most, but some can come in with pre-existing changes to their body, specifically to the nerves, right? You have damage there. So they may not be able to perceive the sensations that are needed to deliver a baby, i.e. the pain, the pressure that comes with it.
Okay.
And so with that, it may be a little bit more thought needed to be put into the plan. Because if she's not able to sense the baby's coming down and ready to be born, it may, in essence, throw off the plan of getting to labor and delivery and make it more likely to have a C-section.
Okay.
So, but knowing that going into that, of course, we can always make a plan around it to be able to monitor, in essence, fill in that gap where she may not be able to sense like other patients.
To that point, if she can't sense and she does have to have a C-section, C-sections are so common and many people don't really, well, they do. I'm not going to speak for you guys, but many people don't realize that C-sections are major surgery. And so when doing a C-section, is the patient awake all the time? Or are they not awake? Or can you give me just a little more?
Sure.
What happens in a C-section?
You're right. A C-section is surgery. It is major surgery, even though we kind of downplay it because it's so common. It tops the list of being common surgeries or reasons why someone's in the hospital. But it is major surgery. We're opening your body up to take another body out. And so with it,
Frigid pig.
you're right. I tell people all the time, it's probably the only surgery you get a prize to take home with you, right? Well, it's not the case. Right, you get a souvenir, a really cute one that's going to be there forever. But with it, there are risks, less than 1% chance that anything would happen that you don't want to happen. But as with most surgeries, if any, you're going to hear about bleeding, infection, damage to organs or the womb itself, the baby, right? The loss of the womb, especially if there's heavy bleeding. And so those things you just have to know are there, but expect that your doctor will be, first of all, equipped and have the knowledge to do the surgery correctly, and then would know how to make sure to proceed in a safe way so those things don't happen. Always great questions to ask before. You're not going to make anyone mad if you want to walk through what to expect, right? Also because you're awake in the room, and that's also a rarity too. Most surgeries, you're asleep, and so you're going to hear things beeping and buzzing and talking happening, and you can't see. I think that's on purpose. But you want to make sure that you are comforted by what's going on and it's not going to cause any cause of concern. But it is major surgery, and then you're at home with a new baby, healing, and we show tough love. You have to take care of your baby right away, which you want to do. And so you want to make sure you don't have any setbacks either.
Okay.
Now, in any situation, we're never going to promote having a C-section because it is surgery. We would love all people to be able to deliver naturally, but we recognize the value in it. And then for MS patients, they would just have to put that in that conversation early in the pregnancy because it may become their reality.
Exactly. Thank you. I appreciate that. By the way, she's just not dressed up like this. She's actually leaving the hospital and has a patient laboring at the hospital. She came to talk to you guys for me. So this is what blessings look like.
Oh,
So thank you so much.
yeah,
Dr.
absolutely.
Tate.
I'm happy to help.
Thank you.
Happy to share.
Thank you. Thank you so much. The baby's been born. Now, mom's in the room. She's recovering from either a vaginal delivery or she's recovering from her C-section. And it's time to start breastfeeding. Is it better for an MS patient to breastfeed a baby or to not breastfeed a baby? Is it the same, or if she has MS or not? Or does MS matter at all? Is that a factor to consider?
It is a factor, as with any medical condition and being pregnant. It's always a concern, especially if you're on medication, right? Is anything going to pass through the breast milk? Or is that even going to affect how my breast milk is produced? And then the opposite is, could it affect my condition? And the answer is actually it is not something that would be detrimental. So it is supported, it is encouraged, So, but it is still ultimately a personal decision as to whether you would want to breastfeed or not in any situation. What we have found is that with MS and breastfeeding actually, again, keeps your condition a little bit better. Medications as well. The general rule applies. Something safe in pregnancy is safe with breastfeeding, and the medications that we know overall benefits far outweigh any potential risks. So we encourage patients to stay on their medication.
Okay. Well, thank you for that. Yeah. In the same vein of breastfeeding and stopping breastfeeding, if an MS patient is breastfeeding her baby and her symptoms have been controlled, she stops breastfeeding and she begins to relapse. Well, let me ask you this way. Will she relapse for certain, or will she potentially relapse? And if that's the case, are the relapses worse after she begins to relapse in your experience?
So not all patients will relapse. Really, it goes back to, again, how things start or where things were before the pregnancy started. That's where you should return. So there's no exact number of there's no exact number, the likelihood of relapse, and we just know that it could happen, just in general nature of how the body works.
Okay.
So with that, it's not at all then that the patient should be concerned about or hesitant to do whatever the post-delivery plan is that they want to see happen. But I would definitely encourage everyone to make that plan, to circle back with the other doctors right now. Because by that time, your obstetrician is exited, the high-risk doctor like myself has exited your plan of care, you're back with your primary team. And that will be a great touch point time to make sure that they are there to support and make sure that everything's in place so you don't relapse. So they may have you take medication a little bit more of it for a while, kind of get through that transition. They may just want to see you more often. It can look different for everyone.
Thank you. Okay, baby's out. You started your postpartum period. Right when the baby comes out, that's when the postpartum starts.
Yeah.
Now you're a different person. Your hormone levels are going to rapidly start changing once the baby is out. Since the hormone levels are changing to facilitate the baby and you, but primarily because you're going to be taking care of the baby, does that have any adverse effects on the mother's mobility? And if it does, do you have any suggestions for it?
So when you talk about mobility in the realm of pregnancy, you'll see more talk lean towards the pregnancy period just because of the weight of the pregnancy and the pelvic floor, right? Those muscles and those structures underneath the baby. And that's really where the talk is focused on staying in contact with physical therapy, addressing any weakness. And for anyone who's had a baby, I highly, highly, highly encourage you to see a physical therapy specialist that specializes in pelvic floor physical therapy, because that area just naturally weakens from carrying a baby for 10 months. And so with that, even if there's not a change, so you're saying, well, where's the biggest chance I'm going to have a change or weakening?